Welcome to The Real Story. I'm Dr. Ken Richter, and insurance talk from all the areas is a hot topic today and a source of much debate. Most recently, restaurants have been participating in restaurant insurance. Today, I'm honored to have Miss Godiva Nutella, and she is the Executive Vice President, let me get this right, Miss Nutella, for the Restaurant Industry's Professional Organization for Finance.
That's right, correct.
Let's jump right to it. Please, can you tell me a little bit about your company?
Absolutely. Dr. Ken, thank you so much for having me on your show. I hope you don't mind. I brought along our manual. I want to make sure that I give a transparent recall of this restaurant insurance. We've noticed that the United States have become accustomed to the insurance industry, so we thought that we could enhance the dining experience by offering a restaurant insurance. Participating restaurants would accept the restaurant insurance as a payment model for their food items.
Oh, I see. So the patrons would go to the restaurant that participates in your insurance product, and then they could use their insurance to pay for the meal. Is that correct?
That is exactly correct. Each patron has a certain plan with a monthly contribution for services. Then once they reach their de-edible fund,
Their de-edible fund, is that like a deductible with standard insurance?
Oh, yes, that's correct. We don't like to use other insurance terms, so our first dollars are a de-edible fund.
Oh, okay, I see. I'm sorry, I didn't mean to interrupt you.
No worries. As I was saying, once the patron pays the de-edible fund, then they eat for free or a reduced cost depending on their time and place.
Okay, well, how many restaurants are participating in this restaurant insurance plan right now?
Well, actually, most major cities are participating in our restaurant insurance.
So anywhere in the United States?
Yep.
Okay. Is there much... Is there much of a wait for the insurance or for the restaurants today?
No. Generally, you'll wait about 2 to 3 weeks for a reservation.
2 to 3 weeks.
Yes.
Okay.
And so it's a little bit of time, people are jumping on this quite a bit.
Okay.
And we have a modest 60 to 90 minute waiting time. And then you have about 15 minutes to eat your meal.
So it's a 60, 90 minute waiting time at the restaurant.
Oh, correct.
Okay.
And then you have 15 minutes to enjoy your free meal.
I get you. That seems like that's really a long time. Is there anything being done to help that time go down a little bit?
Yes, actually. In some restaurants, we're serving a portion at a time. So one visit, you'd have your appetizer, and then the next visit, you could come back for your entree.
Thank you, Ms. Nutella. We have an example of a statement from a patron that visited a participating restaurant. And there's some questions that I have here that I'm wondering if you can make a comment about their claim.
Oh, of course. We at our organization, Restaurant Industry Professionals, Organization of Finance, we want to be transparent and want to educate our patrons, of course.
I see. Okay, well, let me start off with the first item on the list, and this is from one of the patrons that are participating in the restaurant, and he bought an appetizer. And at this restaurant, the appetizer selected, which I have here, is $80 on the menu. The patron told our producers that he had met his $1,000 deductible.
Oh, you mean de-edible, remember. Once you reach your de-edible, everything is free.
I'm sorry, I'm getting that mixed up. But, okay, he reached his de-edible fund. And then your fund, your insurance, paid 80% of the meal.
80%? Oh, yes, I see right here. He was on Plan C, which means that he carries less money per month, but you assume 20%. But once you pay the 20%, then the item's free.
Okay, so part of this invoice was his appetizer, and he paid 20%, which was $16.
Yes, that's the way our plan works.
Okay. Well, the concern I have is that the appetizer's cash price is $8, and this patron used his insurance and paid $16. So I'm wondering, why wouldn't this patron just pay cash?
Well, why would he? He's covered by his insurance plan. Once he pays the minimal fees, everything is free.
Okay, well, let's move on to the entree. Now, it looks like he ordered a T-bone steak and was charged the full $320 for the steak. None of this is covered with his insurance.
Yes, you see, it states right here on page 162, paragraph 2 in our industry's online manual that when you order more than a 6-ounce sirloin, you need to seek a pre-menu approval 3 days in advance.
is this like a pre-authorization for medications with the health insurance?
Well, no, because this is a pre-menu approval, and we're talking about steak.
So that's the difference. Okay. Well, let's move on to the last item, the dessert, which is the best item usually on a menu. And in this example, the patron was charged a full $120 for a slice of cherry pie. That seems a little steep to me.
Well, once again, on our online manual, you'll see that we state you need to eat at least 2 desserts you don't like before you can have the cherry pie, which is the 3rd tier dessert. Or you can have 1 scoop of vanilla ice cream for free.
Oh, well, okay, so let me add this up. An appetizer for $16. It was $80. You paid 80%. They paid the $20, $16.
Right. Mm-hmm.
A T-bone steak, which was $320 because
right.
they didn't get the pre-authorization
Pre-menu,
for the steak.
pre-menu.
Pre-menu. I'm sorry, pre-menu.
Yeah.
Dessert for $120 because they needed to get 2 desserts they didn't like before you'd pay for that.
Correct.
So the total comes out to $446 for their meal. Now, we asked the restaurant of this patron for a cash price, and we were told it was $42 for the meal if they had paid cash. So, just to help our viewers, why would this patron just not pay cash?
Well, Dr. Ken, because he has our insurance plan. If he's paying the monthly insurance fees, then he'll want to use his card. Remember, once he pays his de-edible fee, then his meal is free.
Okay, well, that's all the time we have today, Miss Nutella. I really want to appreciate for you coming in and helping us with this restaurant and insurance. But before you can go, can you tell our viewers how to contact you?
Absolutely. You can go to our website, we've used the first letters of our name, the Restaurant Industries Professional Organization for Finance. So that's www.ripoff.us. So once again, www.ripoff.us.
Thank you again. This is Dr. Ken Richter for The Real Story. Join us next week for How to Insure Your Pets. Now for a commercial message. Goodbye.